You know, it's kind of amazing when you hear it. This tech service, ICYC, they've answered over 79,000 questions about sex and sexuality in just 6 years.
Wow.
That number.
hmm
It just really tells you something, doesn't it? Everyone has these questions, these curiosities, big or small.
It absolutely does. It shows, this universal need to understand this whole area of life. And it really highlights the need for information you can actually trust.
Exactly. And that's exactly why we're doing this deep dive for you today. You actually pointed us towards a really great resource, in case you're curious. Questions about sex from young people, with answers from the experts.
hmm
And this book, it's like having a direct line to the people who really know their stuff,
hmm
the trained sex educators at Planned Parenthood. They tackle everything from the really basic questions to maybe the ones you felt a bit, I don't know, awkward even thinking about.
Yeah, and what's so valuable about it, I think, is its main goal. Just getting solid, reliable information out there. To young people, sure, but really to anyone with questions. And doing it in a way that's, straightforward and totally free of judgment.
Right.
It's all about empowering people, giving them the tools to make informed choices
Yeah.
about their bodies, their relationships, their sexual health, all of it.
Precisely. So think of this deep dive as your shortcut, your fast track to getting clued in. We're going to explore some of the main things the book covers, like sex itself, anatomy, puberty,
Uh-huh.
attraction, STIs, pregnancy, birth control, relationships, and of course, the really crucial topic of consent.
Yeah, all the big ones.
We're basically pulling out the key takeaways, the stuff that clears up the common confusion points, all with you in mind. Okay, so let's jump right in. Chapter 1 kicks off with a question I bet a lot of people have wondered about. Can you die from masturbating too much?
Ah, yes. That's definitely a question that probably taps into some old anxieties or myths, maybe.
Sure.
And the book tackles it straight away. It reassures readers that, look, neither masturbation nor sex itself is going to kill you. When you hear about deaths happening during these activities, it's almost always because of some other underlying health problem.
Okay, that's definitely good to hear.
Mm.
The book really emphasizes that both are, healthy, normal parts of life, but then it moves pretty quickly into something really personal.
Mm.
Deciding when it's the right time for you to have sex with someone else. What are the main things they point out there?
Well, they really stress how important it is to feel genuinely comfortable, like truly comfortable, and being able to talk openly about boundaries with your partner.
That communication piece.
Absolutely. And thinking about protection,
Right.
from STIs and pregnancy and knowing how to use it properly, that's crucial. Also, just considering the potential outcomes of having sex. And maybe most importantly, trusting your partner to respect you and feeling confident in your own choice. Those are all really vital parts of it.
I also like that they start with a really clear, inclusive definition of sex. They say oral, anal, or vaginal. And that leads into a really interesting bit about virginity.
Yeah, they make it super clear that virginity isn't like a medical thing. It's totally personal. How you define it for yourself, that's what matters. And there's zero shame either way, being a virgin or not.
Mm-hmm.
They also make a really important point about oral sex. It can't cause pregnancy, obviously, but it can transmit STIs. So using barriers, condoms or dental dams, is still a smart idea to reduce risk.
They even quickly mention tampons, saying that using one doesn't count as losing virginity by their definition of sex,
Mhm.
which makes sense. And then they get into using protection within a relationship, which I think, yeah, a lot of people wonder about that.
It's interesting, they really strongly emphasize that using protection is a personal choice. It doesn't matter how committed or long-term the relationship is.
Right.
The book points out that even married couples might choose to keep using protection, maybe for pregnancy prevention, maybe for STI protection. They stress that, some STIs aren't curable, and getting married doesn't magically change that fact.
Yeah, they really bust that myth wide open that you're somehow automatically safe from STIs just because you're married.
Yeah.
Then they do circle back to masturbation briefly, just
Yeah.
reiterating it's healthy, can't get STIs or pregnant from it. It's private, personal choice.
Mm-hmm.
But getting back to that first big question, the book just states it plainly. The act of sex or masturbation doesn't kill people.
Exactly. They repeat that if, tragically, a death occurs, it's due to other underlying health issues. And they give a pretty balanced view on, how often. Saying you can do it as much as feels right there, as long as it's consensual, doesn't cause distress, and isn't messing with your daily life.
Okay, now, a really, really crucial point they make. Sex should not hurt.
Oh, this is so important. Everyone needs to hear this. The book does acknowledge that, okay, the first time someone with a vagina has penetrative sex, there might be like a brief pinching feeling from the hymen stretching,
Right.
but any ongoing pain, especially later on, with vaginal or anal sex, that could be a sign of something else. Maybe an infection, an STI, maybe not enough arousal or lube, or even a medical condition.
So what should you do?
They strongly advise stopping immediately, talk to your partner, maybe see a healthcare provider. Sex should feel good for everyone involved.
They also tackle something I think is maybe subconsciously on a lot of conscious minds. How long should sex last? Is there a normal?
The book gives a really healthy answer here, I think. Basically, sex can last for as long as the people involved want it to.
Okay.
There's no timer, no set duration. It totally depends on what feels right and when anyone involved wants to stop. And that last part is key. The second someone says stop for any activity, it needs to stop right then.
And speaking of what people want, they dive into arousal. And they really highlight that there's no, like, universal on switch.
Precisely. What turns one person on, maybe a certain touch, words, visuals, music, whatever, might do absolutely nothing for someone else.
So how do you figure it out?
The best way, just ask. They really emphasize talking openly and honestly, respecting each other's boundaries. Just communicate.
Then they explain what an orgasm actually is, that, intense feeling of pleasure. And they also touch on faking orgasms, which definitely comes up.
Yeah, the book points out that, look, anyone might fake an orgasm sometimes for different reasons, but the bottom line is no one should ever feel pressured to. It just highlights again how important honesty and communication are for, actually fulfilling sex.
And of course, they tackle some really common myths. I always find these fascinating, how long they stick around.
Me too. They debunk that persistent one about vaginas getting loose. They explain the natural elasticity. They also clarify that semen itself won't make you sick, though. As we said, STIs from oral sex definitely can. And they firmly shut down that totally baseless fear about testicles exploding from masturbation.
Oh gosh, yes. And what about all the myths around semen taste? They mentioned those too. I know I've heard some wild ones.
Yes, they acknowledge the rumors about certain foods changing the taste, but stress that any changes are probably super subtle, if they happen at all. Definitely not guaranteed. So, yeah, no need to change your diet based on that.
Right. Okay, finally, in Chapter 1, they talk about why some people feel totally wiped out after sex. It's the physical effort, hormones releasing, and they explain lube. Really stressing, use water-based or silicone-based, and definitely don't use stuff like cooking oil or lotion that can cause irritation or infections.
Good advice.
Okay, let's shift gears. Chapter 2, anatomy. And the first question is one I think many people have wondered. So what's like a normal penis size?
Right. So the book gives average measurements for flaccid and erect in the U.S., but they immediately say, look, there's a really wide range of what's healthy and normal. Comparing yourself, generally not helpful. Everyone's body is just different, unique.
They also take the time to clarify the difference between the vulva and the vagina, which I think is still a common point of confusion even for adults.
Absolutely. The vulva is all the external parts you can see. The vagina is the internal canal. And just like faces, vulvas and vaginas come in all sorts of shapes and sizes. Same basic parts, but each one looks a bit different.
And what about breasts? The fact that for many people they aren't perfectly symmetrical, is that okay?
Totally okay. The book uses this great analogy. Boobs are siblings, not identical twins.
Ah, I like that.
It's super common for one to be a bit different in size or shape, usually nothing to worry about.
Now, for people with penises, that extra bit of skin sometimes comes up in conversation, the foreskin.
Yep, that's the foreskin. The book explains circumcision, the surgery to remove it, and notes it's a decision based on lots of factors, cultural, religious, personal. An intact penis, one with the foreskin, works just fine, same as a circumcised one. Hygiene is just a bit different. And again, they stress all penises look unique.
Okay. Then they get into how erections actually happen.
Yeah.
It's pretty amazing, biologically.
It really is. It's all about blood flow increasing into the erectile tissue inside the penis. Sexual excitement triggers it, makes the penis firm up. When the excitement goes down, blood flow decreases. Penis goes back to being flaccid.
And what about blue balls? Is that a real thing? It sounds uncomfortable.
Yeah, blue balls is the slang term for that temporary ache some people with penises feel if they get aroused but don't ejaculate. The book reassures readers it's not actually harmful long-term, and you don't necessarily have to ejaculate for it to go away. But they add a really important ethical point here.
What's that?
Feeling aroused is never an excuse to pressure a partner into sex, ever.
Absolutely crucial. Okay, now where does sperm actually get made?
The sperm factory, as they call it, is the testicles. Production starts at puberty, continues pretty much throughout life. After they're made, they mature in a place called the epididymis. If they aren't released through ejaculation, the body just reabsorbs them eventually.
Moving on to vaginal wetness. What does that actually mean? Is it always about attraction?
So wetness is a natural physical response to arousal, yeah. But the book wisely points out it doesn't automatically mean someone is romantically into you or even liking what's happening sexually.
Oh, interesting.
And the flip side is true too. You can be totally attracted to someone and not get very wet. Plus, you have to remember normal vaginal discharge can also make things feel wet down there.
And why do doctors need to, examine our private parts during checkups? It can feel a bit awkward.
The book explains it's for the same reason they check any other part of your body, just making sure everything's healthy and working okay. They do stress that healthcare providers should always ask permission before touching private areas, explain what they're doing and why.
Right.
And you always have the right to ask them to stop if you feel uncomfortable. Always.
What about that thing that happens when you jump into cold water and,
Yeah.
ooh, things kind of retract? Why does that happen?
Huh. Yeah, that's the scrotum doing its job. It's
Yeah.
like a little thermostat for the testicles. Sperm production needs a very specific temperature. So in cold water, the scrotum tightens up, pulling the testicles closer to the body's warmth to keep that temperature just right.
Fascinating. Okay, question. Will a person ever just run out of semen?
The book reassuringly says no. Someone with testicles won't run out. Production starts at puberty, keeps going, though maybe the volume might decrease a bit temporarily if ejaculation is super frequent.
Okay.
And interestingly, they note that semen, the fluid part, can still be made even if someone doesn't have testicles anymore, though obviously without sperm in that case.
Then there's squirting. Still seems a bit mysterious to some people what's actually happening.
They explain squirting as fluid being released from the urethra during arousal. It's different from pee, and it's a totally normal response, though not everyone experiences it.
And what about that sound? Sometimes called a queef or vagina fart? What's that?
Right, the book clarifies the vagina doesn't actually fart like your digestive system, that sound. It's usually just trapped air escaping. It's mechanical, not biological.
Okay, visually, what do sperm actually look like? Not the cartoon version.
They're described as looking like little tadpoles, yeah, head and a tail. But they're microscopic. You need a microscope to see them. And semen, the fluid they swim in, is usually clear or whitish, kind of sticky, and has nutrients and stuff for the sperm.
Now back to the chapter title. Can you break a penis? Sounds alarming.
The answer is kind of nuanced. Can you break it like a bone? No, there's no bone. But during an erection, if the penis gets bent suddenly and forcefully, the erectile tissue inside can rupture.
Ouch.
Yeah, it's called a penile fracture. It's painful, needs medical help, more likely to happen during really vigorous sex or aggressive masturbation.
And just to be super clear, pee comes out of a different hole than everything else down there for people with vaginas.
Right. Absolutely. Completely separate. Urine comes out the urethra small opening just above the vaginal opening. The vagina is for periods, discharge, childbirth. Two different systems, two openings.
Okay, what about the hymen? So many myths around that.
Oh, yeah. The book specifically lists things like horseback riding, gymnastics, biking, even using tampons, and says these do not cause the hymen to tear. It's actually pretty stretchy. That whole idea that a torn hymen proves someone had sex. Just a harmful, inaccurate myth.
In vaginal discharge, that's normal.
Right.
Not always a problem sign.
Exactly. Discharge is natural, healthy, keeps the vagina clean. But if you notice changes like in color, smell, texture, or if there's itching or burning, that could mean an infection or something else, see a doctor then. And they also strongly advise against douching. It messes up the healthy bacteria.
How often should we be doing self-checks down there? And what about doctor checkups?
Regular self-exams are good just to know your own normal. For people with vaginas, pap smears usually start around 21. For people with penises, yearly checks of the penis and testicles are generally recommended. But really, any weird pain, lumps, bumps, anything concerning, see a doctor. Don't wait for a scheduled checkup.
Does the clitoris change as we age? I feel like that's not often discussed.
The book reassures that no, the clitoris doesn't disappear or anything. Its structure stays the same. Sensitivity might change a bit due to normal hormone shifts with aging, though.
Let's touch quickly on toxic shock syndrome, TSS. Sounds scary.
It is rare but serious. It's a bacterial infection linked to leaving tampons in too long. Symptoms can be like the flu. If you suspect TSS, get medical help immediately. It's crucial.
And for those with an intact penis, how best to keep clean?
Key thing is to gently pull back the foreskin and wash the head of the penis. Warm water, mild soap. Helps prevent bacteria buildup.
One last anatomy question.
Mm-hmm.
Seems obvious, but people wonder,
Yeah.
can you pee with a tampon in?
Yes, absolutely. Tampon goes in the vagina, pee comes out the urethra, separate openings, remember, so totally fine.
Right.
They also briefly mention normal breast stuff like aching or itching and when to see a doctor, and nipple hair, totally normal. And why testicles are outside, it's all about keeping sperm at the right temperature.
Okay, phew. Let's shift gears again. Chapter 3, puberty. The opener is, do guys really come in their sleep?
And the book confirms, yes, wet dreams or nocturnal emissions, ejaculating semen during sleep are common during puberty and can happen later too. Doesn't even have to be linked to a sexual dream.
What about all that awkward flirting and intense crushes that just seem to appear during puberty? What's that about?
That's very often those puberty hormones surging. Leads to new, sometimes kind of overwhelming romantic and sexual feelings. The book says feeling nervous, awkward, just weird around someone you like, totally normal for this stage.
And it's not just sexual feelings that get intense, right? I remember everything feeling bigger.
That's absolutely right. All kinds of emotions can feel stronger, swing more wildly. It can feel like a real roller coaster sometimes. But the book reassures it does tend to even out as you get through puberty.
Why do so many people get acne during puberty? It's so frustrating.
Super common. Again, hormones increase oil production, pores get clogged. It's definitely not about being dirty, but washing your face regularly with a gentle cleanser can help manage it.
Then there's the sudden arrival of pubic hair. What's the advice on dealing with it?
The book really stresses it's totally a personal choice. Remove it, trim it, leave it natural, whatever you want. If you do remove it, just remember the skin there is sensitive, so maybe get advice from a trusted adult on safe ways to do it.
Here's a basic one some might be shy to ask. Why don't people with penises get periods?
Simple anatomy, really. Periods happen when the uterus sheds its lining. People with penises don't have a uterus.
Makes sense.
The book also makes an important clarification here. Boy is about gender identity. Someone who identifies as a boy but was born with a uterus can still have periods.
What's a typical period like? Length? Frequency?
Usually the bleeding part lasts about 2 to 7 days. The whole cycle, from the start of one period to the start of the next, averages around 25 to 30 days. But there's a lot of variation between people and even month to month for the same person. Usually starts during puberty, goes till menopause.
Do hormones really cause all the mood swings, often linked with puberty, especially for those who menstruate?
Hormones definitely play a big role, yeah. Especially in the days leading up to a period for people with vaginas. But it's good to remember mood changes can have other causes too. It's not just hormones.
And what about period cravings? Is that a real biological thing?
Well, the common wisdom is that craving chocolate is all hormones. But the book suggests it might be more about seeking comfort foods than a direct hormonal trigger.
What kinds of period products are out there now? Seems like more choices than before.
Definitely. You've got pads, tampons of different sizes, reusable menstrual cups, sponges, and period underwear that absorbs the flow. The book advises just checking the package for instructions on how to use whatever product you choose.
And those awful period cramps, what causes them, and how to get relief.
Cramps are the uterus muscles contracting to shed the lining. How intense they are varies a lot. If they're consistently really bad, see a doctor. For relief, try heat on your belly, over-the-counter pain meds, or even gentle movement or exercise.
The book also makes a point to say that exploring your sexuality, alone or with others consensually, is normal, even during puberty. Then it mentions morning erections. Why do those happen?
Morning erections are described as totally normal and healthy, especially during puberty. Could be due to relaxation during sleep, hormone levels being higher in the morning. Doesn't necessarily mean you had a sexual dream.
What if someone going through puberty just really wishes it wasn't happening? It can be a tough time.
The book acknowledges that feeling. It emphasizes puberty as natural, big, physical, emotional, social changes. Talking about those feelings with a trusted adult, like a parent or counselor, can really help navigate it all.
And puberty isn't contagious, right? Just feels like everyone hits it around the same time.
Exactly. Not like catching a cold. It's a gradual process, usually starts between 8 and 16, but the timing is different for everyone. They even mention hands and feet growing, often being early signs.
Okay, specific question here. Sounds potentially harmful. Can you put a tampon in your butt?
Ooh, definitely not. Tampons are only for the vagina. Putting anything not meant for the anus in there can cause injury or infection. Bad idea.
What's the deal with the Adam's apple?
That's actually the larynx, the voice box, getting bigger during puberty. More noticeable usually in people with penises, and it's what makes the voice deepen.
And when is someone finally fully grown after puberty?
Well, growing up is complex. But physically, puberty starts between 8 and 16, involves growth spurts and lots of changes, and it can take many years to fully complete that development into adulthood.
Right. Okay, let's move to chapter 4. This covers sexual attraction, orientation, gender identity, expression. First question. Is 12 too young to know I'm bi?
The book jumps right into clarifying terms here. Gender identity. Your internal sense of self, male, female, both, neither, something else. Gender expression, how you show your gender outwardly, clothes, behavior. Sexual orientation, who you're attracted to, romantically or sexually.
Gotcha, 3 different things.
Exactly. They can align or be different for different people. Key thing is respecting how someone identifies, without assuming. They define gay, lesbian, straight, bisexual briefly, and mention the gender unicorn as a visual tool for understanding these dimensions.
They also explain the difference between sex assigned at birth and gender identity. This is super important, though still confusing for some.
Yes, fundamental. Sex assigned at birth is usually based on visible anatomy, chromosomes. Gender identity is your internal feeling of your gender. For some, they match up, cisgender. For others, they don't, transgender.
In transitioning.
That's the process of affirming your gender identity. It can be social things like changing name pronouns or medical steps. There's no single right way. The most important thing is respecting someone's self-identified gender.
The idea of more than 2 genders can be challenging for some people. How does the book handle that?
It acknowledges that while many identify as men or women, lots of people identify outside that binary. It emphasizes respecting everyone's identity, giving examples like intersex, genderqueer, gender fluid, non-conforming. Basically, honor how someone tells you they identify.
Sometimes we're curious about who our friends are attracted to. Is it okay to just ask?
Natural curiosity, maybe, but the book stresses that sexual orientation is really personal. People should share it if and when they feel comfortable and safe. Best to let them bring it up on their own terms.
What if someone just isn't interested in sex? Is that okay?
Totally okay. The book validates that having little or no sexual desire is normal and healthy. Some people identify as asexual or ace. That's a valid orientation.
Coming out, the book suggests it's not always a one-time thing.
That's a really important point. Coming out, sharing your orientation or gender identity is often an ongoing process for LGBTQ+ folks. It's a decision they might make over and over depending on the situation, who they're with, how safe they feel.
If a friend comes out as gay, what are good ways to be supportive?
The book gives simple but powerful advice. Listen. Try to understand. Show you care. Ask what support they need. Offer public support if they're comfortable with that and it's appropriate.
Why do some people use the term partner instead of boyfriend-girlfriend?
Several reasons. Partner is inclusive, doesn't assume gender, good for same-sex couples, or if a partner is non-binary. It can also avoid accidentally outing someone. And for some, it just feels like a better fit for their relationship. Bottom line, respect the term someone uses.
Finally, in this chapter, they explain heteronormativity versus heterosexism. Important terms for understanding bias.
Right. Heteronormativity is the assumption that being straight is the default or normal, often unconscious. Heterosexism is the belief that being straight is superior and other orientations are wrong or lesser. Both can harm LGBTQ+ people.
Okay, let's tackle Chapter 5, STIs. Starts with, can you get an STI from kissing?
Before answering that directly, the book emphasizes something crucial. STI symptoms often aren't obvious. Many are asymptomatic, no symptoms at all.
Wow.
So the only way to know for sure if you have one, get tested. They list some common symptoms, sure, but the main point is no symptoms doesn't mean no STI.
And testing isn't automatic at a regular checkup, right?
Usually not. You typically have to specifically ask for STI tests.
Here's one to maybe ease some anxiety.
Right.
Can you give yourself an STI through masturbation?
Nope, absolutely not. Can't get one that way. If you already have one, you won't reinfect yourself elsewhere via masturbation. And if you don't have one, you can't create one solo.
Let's talk HIV. How is it actually transmitted? Still some myths floating around, I think.
HIV, human immunodeficiency virus, spreads through specific body fluids. Blood, semen, pre-cum, rectal fluids, vaginal fluids, breast milk. Really important. It's not spread by casual contact like hugging, sharing food, using the same toilet.
And how serious is it? Long-term effects?
With good treatment, people with HIV can live long, healthy lives. But untreated, it can progress to AIDS-acquired immunodeficiency syndrome. That severely weakens the immune system, making it hard to fight off infections.
We often think STIs only spread through penetrative sex, but the book says there are other ways.
That's right. Most are spread via oral, anal, or vaginal sex. But some, like herpes or HPV, can spread through skin-to-skin contact with an infected area. Others can spread via sharing needles, breast milk, or during childbirth from parent to baby. So yeah, you could potentially get an STI without ever having penetrative sex.
What's the most common STI?
That would be HPV human papillomavirus, actually a group of over 200 viruses. Super common, spread by skin-to-skin contact, usually during sex. Very prevalent, especially among teens and young adults.
Here's a slightly weird question. If two people who are both STI-free have sex, can they somehow create one?
Huh. No, biologically impossible. An STI has to come from someone who already has it. But remember the asymptomatic thing. Someone might have one and not know it. That's why using barriers like condoms or dental dams consistently is always safer practice. The book even jokes about getting tested together as a date idea.
You definitely can't tell if someone has an STI just by looking, can you?
Absolutely not. Zero way to tell just by looking. Testing is the only way.
What about catching STIs from toilet seats? Old rumor. Any truth?
Very unlikely, the book says. The fluids STIs live in don't survive long on surfaces like that, and you'd need direct contact with broken skin. Not typical.
How dangerous are STIs if they're left untreated?
Untreated STIs can be really dangerous long-term, can lead to serious stuff like infertility, chronic pain, even increased cancer risk for some. Early testing and treatment are absolutely key.
Any idea how long STIs have been around? Feels like forever.
Probably have been around throughout human history, like many diseases. Hard to pinpoint exact origins, but what matters now is we know how they spread, how to prevent many, and how to treat them. Abstinence, using condom dams, and regular testing are the tools we have.
Let's clear this up. UTIs, urinary tract infections, are they STIs?
No. UTIs are bacterial infections, usually in the urinary tract, urethra, bladder, kidneys, not STIs. Though sexual activity can sometimes increase UTI risk. The book lists UTI symptoms and suggests peeing after sex can help prevent them.
How will the condoms actually work for STI prevention? Are they foolproof?
Condoms are highly effective when used correctly and consistently. Every single time, from start to finish, put it on halfway through, not going to offer much protection.
What exactly is a dental dam? And where do you get one?
It's a thin square of latex or polyurethane. You use it as a barrier for oral sex on a vagina or anus to prevent STIs. You can sometimes find them at health centers, online, or you can make one by carefully cutting open a latex condom.
Are there condoms for people with vaginas? Most people just know the external kind.
Yes. Internal condoms, sometimes called FC2. They go inside the vagina and protect against pregnancy and STIs. The book mentions some pluses. Pre-lubricated, often nitrile, good for latex allergies. Warm to body temp, cover more of the vulva.
Before you even have sex, are there things you could do to protect against STIs?
Definitely. Getting the HPV vaccine protects against many strains that cause warts and cancers. For HIV, there's pre-exposure prophylaxis, a daily pill that's highly effective at preventing transmission. And like we keep saying, talking openly with partners about protection and testing history is huge.
If someone tests positive for an STI, is it always for life? Or can they be cured?
Some are curable, especially bacterial ones like chlamydia, gonorrhea. Antibiotics usually work. Viral STIs like herpes and HIV aren't currently curable, but there are effective treatments to manage them, reduce symptoms, lower transmission risk. Testing tells you which type it is.
Silly question, maybe, but can you use a regular condom on your tongue for oral sex?
The book strongly advises against that. Big choking hazard. For oral sex, use dental dams for oral vaginal. For oral penile, use external condoms, non-spermicidal or flavored are options.
Are STIs only spread through fluids or other ways too?
Good question. Many spread via fluids, semen, pre-cum, vaginal fluids, blood. But others, like herpes, syphilis, early stages, and HPV, can spread through direct skin-to-skin contact with an infected sore or area. Genitals and mouth are common spots.
Besides the main fluids, any other transmission routes?
Yep, as mentioned, some can pass through breast milk if the nursing parent has it, and some can pass from parent to baby during childbirth.
HPV sounds really complex. Lots of strains, different outcomes.
It is complex. Over 200 types. Some low-risk ones cause genital warts. Some high-risk ones, if untreated, can lead to cancers. But most HPV infections are actually harmless, clear up on their own, no long-term problems. If you test positive for a high-risk strain, talk to your doctor about monitoring and care.
If someone gets treated for an STI, when is it safe to have sex again?
General advice. Wait at least 7 days after finishing all the meds for a curable STI and wait till any symptoms are totally gone. For non-curable viral STIs, consistent barrier use is vital, and talking to partners about your status is important.
Where can people go to get tested? Not always obvious.
Lots of places. Your regular doctor, local health department, Planned Parenthood, other community health clinics. Many offer confidential, affordable testing. Some at-home tests exist too, but follow up with a doctor if you test positive.
So just to repeat a key point, herpes and HPV can spread just through naked skin-to-skin contact, even without other sex acts.
Exactly. A really crucial takeaway. Barrier methods matter even beyond penetrative sex.
Finally, and this can be tough, how important is it to talk to a partner about STIs before sex?
Absolutely essential. It's about respect, caring for their health and yours. Being open about history and concerns allows both people to make informed choices and take precautions together.
Okay, wow. That was a really thorough dive into a lot of incredibly important info. It certainly was. And it really shows the book's commitment, doesn't it? Making accurate, non-judgmental answers available to anyone who's curious.
So, to kind of wrap it up for you, our listener,
Yeah.
what are some of the biggest takeaways from all this?
I think a huge one is just how vital, reliable information is. It's the foundation for making healthy choices about everything related to sex and sexuality. And that huge number of ICYC questions, it just proves curiosity is normal, nothing to be ashamed of. We've also seen how nuanced this stuff is, defining sex personally, understanding STIs, the diversity of gender and orientation. Absolutely. And this deep dive, which came from your interest in this great book, was really meant to give you that clear, engaging way into understanding these key things without feeling totally buried in information. And remember, asking questions. That's a strength. It's taking care of yourself. And finding reliable sources like this book, that's a really positive step.
Totally. And if anyone wants to go deeper, the book itself has conversation starters and links to more resources for every topic we covered: STIs, relationships, puberty, consent, pregnancy, identity, orientation, birth control. All of it. Plus that ICYC text line 57890 and their Instagram @In Case You're Curious. Those are great ongoing resources too for any questions still popping up.
So as you continue figuring things out, your experiences, relationships, yourself, just remember that your understanding, your boundaries, they're always evolving. And seeking knowledge, talking openly, those are incredibly powerful tools for that whole lifelong journey.